Alcohol use screening tests are essential tools in modern healthcare, designed to evaluate a person's drinking habits and identify unhealthy alcohol use or the risk of developing alcohol use disorder, commonly known as AUD. These tests are typically administered as questionnaires, with individuals providing honest answers about their alcohol consumption patterns, frequency, and the impacts alcohol may have on their daily lives. This process helps healthcare providers detect alcohol misuse early, often before it causes significant health, social, or psychological problems. Unhealthy alcohol use encompasses a spectrum of behaviors, from drinking more than the recommended limits to binge drinking, and ultimately progressing to AUD. AUD is a brain disorder characterized by an inability to control or stop drinking despite experiencing negative consequences in personal relationships, work, or health. The disorder can range in severity from mild and moderate to severe, with the most severe cases historically referred to as alcohol dependence or alcoholism. A key aspect of alcohol use screening is identifying binge drinking, which is defined by the consumption of a significant amount of alcohol in a short period, leading to a blood alcohol concentration of 0.08% or higher. For men, this typically occurs after consuming 5 or more drinks within a few hours, while for women, it is 4 or more drinks in the same time frame. It is important to note that not everyone who binge drinks will develop AUD, but this pattern of drinking is a major risk factor for the disorder. The purpose of alcohol use screening tests is twofold: to detect current unhealthy drinking behaviors and to assess an individual's risk of developing more serious alcohol-related problems in the future. By identifying these risks early, healthcare providers can work with patients to develop strategies for reducing alcohol intake and, if necessary, initiate treatment plans tailored to the severity of their condition. There are several well-established alcohol use screening tools, each with its own format and focus. The most widely used include the Alcohol Use Disorders Identification Test, Audit. This comprehensive test consists of 10 multiple-choice questions that explore how much and how often a person drinks, as well as any alcohol-related problems they may have experienced. Each response is scored, and a total score of 8 or more suggests that the individual may have AUD or is at risk of developing it. Audit C. A shortened version of the full audit, this tool contains 3 core questions. Each answer is scored from 0 to 4 points. Higher total scores indicate a greater likelihood of AUD. CAGE questionnaire. Although less commonly recommended today due to the availability of more effective tools, the CAGE questionnaire remains in use in some settings. It consists of 4 yes or no questions that look for signs of problematic drinking, including feeling the need to cut down, being annoyed by criticism of drinking, feeling guilty about drinking, and using alcohol first thing in the morning. An eye-opener. Answering yes to 2 or more questions may indicate the presence of AUD. NIAA. Single alcohol screening. Question SASU. This tool simplifies screening to a single question, asking how many times in the past year a person has consumed a certain number of drinks in one day, 4 for women and 5 for men. If the answer is 1 or more times, further questions are usually warranted to assess for AUD risk. Screening with brief intervention, SBI tools. These consist of a series of yes or no questions designed not only to identify alcohol misuse, but also to guide brief counseling sessions. These interventions are aimed at motivating individuals to change their drinking behaviors and, if necessary, to connect them with longer-term treatment resources. Alcohol use screening is recommended as a routine part of healthcare, particularly because individuals with AUD may not always recognize or admit to the issue. Family members, friends, or colleagues who notice problematic drinking behaviors are encouraged to support their loved ones in seeking a screening. Healthcare providers may also initiate screening if they observe signs such as drinking more than intended, unsuccessful attempts to quit, hiding alcohol use, strong cravings, continued use despite negative effects, increasing alcohol tolerance, risky behaviors like driving under the influence, or experiencing withdrawal symptoms like tremors. headaches, sweating, or nausea. The administration of these tests is typically handled by primary care providers or mental health professionals, some of whom specialize in substance use disorders. The process is straightforward. Patients answer questions about their drinking habits and any related issues. No special preparation is required for these tests, and there are no risks associated with answering the questionnaires. If screening identifies unhealthy alcohol use, or AUD, the healthcare provider will discuss appropriate next steps, which may include brief interventions, counseling, or the development of a comprehensive treatment plan. For those with mild or moderate issues, interventions may focus on education and support to reduce drinking. For more severe cases, treatment may involve medical, psychological, and social interventions, sometimes including medication and long-term therapy. Many of these questionnaires, including the audit, are available online for self-assessment, though it is always recommended to discuss results with a healthcare provider for an accurate diagnosis and personalized care plan. In summary, alcohol use screening tests are vital measures in assessing and addressing alcohol misuse. They empower individuals and healthcare professionals to identify problems early, reduce the risk of developing more serious health conditions, and provide a pathway toward recovery and healthier living. With no preparation or risks involved, these tests are accessible tools that can make a profound difference in both individual health outcomes and public health at large.